My name is Benny Samuel. I'm the project head for Mediterranean Hospitals. We are an Indian-based hospital, and currently we have established ourselves in Kenya. And our first facility in Kenya is in Homa Bay. We are in Homa Bay for the last 1.5 years. We have started a Mediterranean Hospital Emergency Care Center in Homa Bay. And we are a true emergency care hospital which functions 24 hours with a full-fledged medical team around the clock. And we have been doing the services in Homa Bay for the last 2 years. And in this year, we decided that we bring specialists from India on a timely basis. So when they come to Kenya, it's an opportunity for the society and the patients in Kenya to interact directly with the specialty doctors and get a cure for their treatment. So it's a free service that we are doing today. So today we have 4 doctors come from India with the various specialties like pediatrics, cardiology, ENT and orthopedics. And today morning we started the service. They have done a tremendous job. We have seen over 200 patients. And this is the first time we are doing something related to orthopedics, and we have good number of patient base coming in from orthopedics, and I hope we will continue to have these doctor services on and off, and that will be a service to this community. Homa Bay, predominantly if you see, HIV AIDS, Homa Bay is very predominant. Sickle cell disease, again Homa Bay is very predominant. The pregnancy morbidity, Homa Bay, there are quite a few numbers. But however, today the specialties come here are orthopedics, cardiology, ENT and pediatrics.
I am Dr. Manu. I am a cardiologist with a 16-year experience. My parents' center is Mediterranean Kollam Hospital. I am coming here for the first time. Today I have seen more than 50 patients, almost 50-60 patients, and most of the cases were hypertensive. And the patients were not taking medicines properly. And diabetes also, they were not taking medicines properly. And this hypertension and diabetes, most of it detected for the first time when they got admitted here. See, actually you require a screening. After 40 years of age, you require a regular screening to diagnose hypertension or diabetes, because hypertension and diabetes are called silent killers. They initially for 5 to 10 years, they won't produce any symptoms or signs. Only when they develop complications, only they will come to hospital. So that should not be the issue, because they require lifelong treatment and they require regular follow-up also. Here what happens is that when we diagnose hypertension and prescribe medications, they will take medicines only for 1 or 2 weeks and then stop. And then they will come with complications. That's the issue. So awareness is definitely an issue, and we are going to correct that. We need to educate them properly about the need for taking medicines lifelong and regular follow-up is also a must. And today we have seen one 16-year-old girl with a renal disease patient with a very high blood pressure, almost 250, 150, and she's not taking a drug properly also. And she requires definitely a nephrologist consultation also. She's nephrologist consultation is definitely lacking in this area also. She requires a nephrologist consultation at least at Nairobi. So she has to go to Nairobi. But when I asked her, she came alone. Actually, that patient is very sick. 16-year-old girl, very sick, not coming along with her parents is also a very dismal sign. Actually, it is not good. Anyway, I have started medications, but the problem is that she requires regular follow-up. Whether she is on regular follow-up, I'm not sure actually. Yeah, the regular follow-up is a must. So you have to educate the patient and you have to educate the parents regarding the matter. And further advanced treatment is also required. As far as cardiology is concerned, we have basic amenities like echocardiogram and ECG, by which we can diagnose almost the basic conditions. But if the patient requires an advanced treatment like an angiogram or angioplasty, then they have to go to higher centers. I don't know whether it is available in this area or not sure. If facilities available, we can start a cath lab and we can bring patients and we can do.
I am Dr. Sujit. I am an orthopedic surgeon. I came from India. Today I saw a lot of patients, like close to around 100 patients I saw. And most of them were having severe pain involving knee, multiple joints and back. This seems to be a most common problem. And what I found was that all of them were like at the end stage. We couldn't find any early stages, because most of these things can be prevented or it can be delayed. But what I found out now is that it has come to that stage where medication has less role. We need to do more surgeries for correction. And at this time, like doing surgeries by joint replacements, we need specific centers for that, because specific theaters are required. This is a one-time surgery. You don't want to get it infected or you don't want to do it next time. It's a single-stage surgery. So that kind of facilities I didn't see anywhere, and lots of patients need it. Mostly around, I see all the knee pains which came to me Surprisingly, I felt very sorry because I couldn't do anything more than that. I could just prescribe medicine and I know that they will be having pain when the medicine ends. So, and along with that, there are arthritis, joint arthritis, multiple joint arthritis. This requires medication and follow-up every monthly. Where in my place, I keep the patients on follow-up for every 3 weeks. I change the medicines like that. Here I found a patient who was having medicine continuously. She's taking it for a 34-year-old. She's taking it for more than 2 years. Didn't change at all. Now she's having severe gastritis, a complication of taking the drug for too long. So a specific center, a specific follow-up, and all those things are needed. That's what I found, because most of the patients, I didn't know, they came for me and they're just symptomatically treating. They are not treating the disease as such.